Hello, Baroda Eye Institute welcomes you. Today, I will show you how to use eye drops. To begin with, I will show you how to open new bottle of drops. Please check name and expiry date before opening new bottle. Sealed bottle has a ring like this below the cap. Open the cap, remove and discard the ring. Then close the cap tightly. This will puncture the dropper tip. There is a sharp part inside bottle cap to prick the dropper. Never use needle or any other sharp object to prick or puncture the bottle. Moreover, be careful that dropper tip does not touch eyelashes, fingers or anywhere else while putting the drops or closing the cap. Now, we will see how to put eye drops. First of all, wash the hand thoroughly with soap, so that bacteria and dust particles from hand do not spread inside the eye. This is important to prevent eye infections. It is easier to put eye drops while lying flat without using pillow. Then instruct patient to look upwards and keep both eyes open and relaxed. Pull the lower eyelid gently, and put one drop in the eye, as shown here. After installation of drop, ask patient to gently close both eyes for 2 minutes. Do not close the eyes too tightly. Only one drop is sufficient of any drug. Put another drop only if first drop spills or falls outside the eye. If more than one type of eye drops have to be used, always keep time gap of 5 minutes between them. Some drops cause eye irritation for few minutes. If eye gets red or feels burning, do not worry. It should go away in few minutes. Do not rub or squeeze the eye after putting drops. And if tears or drops flow out of the eye, you can gently wipe it away from the eye. But, do not touch the eye. And last, let's see some important points. Do not use any drops without doctor's advice. Do not share your bottle with any other person. Check expiry date before opening bottle. Once opened, do not use the bottle for more than 1 month. Do not put eye drops over contact lenses. Ensure that tip of bottle does not touch anywhere. Wait for 5 minutes between different type of drops. If allergy or reaction develop, stop using drops and contact your doctor immediately. Do not use needle or any other sharp object to pierce the bottle. Thank you for paying attention. Wish you an excellent eyesight forever.